There they are. Very good. That works. So, marvelous. So what could be important parts of patient education and what could be the value? And here I just made a list of potential values. So it's important that there is an improved understanding for patients, that they better understand what is possible, what is not possible, which methods there are to manage the disease. We really feel that patient empowerment is very important. We still see that quite often patients cannot properly convey the message to the doctor that is actually treating them, especially on a GP level. That's still an issue. We want to increase compliance. There is a really interesting study from Luc Rudmick in Canada who showed that patients with CRS use corticosteroids for an average of 2 to 3 months a year, and then only part of what they actually prescribed. So and if patients understand better what the disease is, they will be hopefully more compliant. We want to convey patient outcomes, because if patients really understand what outcomes are possible, they probably will react better to their treatment and all the other things you have read by now. So what we thought is, how are we going to attack this problem? And we did a number of things. First, we asked quite a large group of you to give us a list of the questions you felt were most often asked in your daily practice. So just send us a list, and we collected all those questions and combined them into groups and tried to give all those questions to patients. Then we had interviews with small groups of patients in 5 different countries in Europe to have a more in-depth discussion with them about their needs and about their questions. And then based on those 2, we made a long list of, or a longer interview, and sent that web-based to a larger group of patients in those 5 countries again. And finally, as Peter alluded also to, we developed a website and an app, and I want to show you some of these things. So this is the top 20 questions that first were asked from you and then asked from patients. And they're very logical questions. You will all feel that that's the sort of questions you get in your daily practice. Can you cure me? And what is the best treatment? And when will my symptoms come back after surgery? And well, this will not be a surprise. I think this is the sort of questions we all know are asked to us every day. So then we had in these 5 centers, first in Amsterdam and then in Leuven, Graz, Barcelona and London, in-depth interviews with patients. And they were very useful but also very emotional evenings. So here is a picture of the meeting in Leuven. We presented them with questions, but also asked them to fill on whiteboards, just talk together and say, well, what are our real needs? What do we really want to know? And we asked them, how was your patient journey? Very modern term, but how did it happen to you? How did you feel? How long did it take before someone finally took you seriously? Things like that. And then we had brainstorming discussions about how we could improve care. So these were the key themes identified during those patient focus groups. And I thought it was really interesting to see how many general symptoms are actually bothering patients most? It's not that much about blocked nose. It's a lot about other things. And of course, impaired sense of smell and taste is a very important aspect, but also sleep disturbance, headache, pain, always feeling tired and depressed. So that were the symptoms patients were telling, and what the impact was, and why they were, was really bothering them. For example, they felt ashamed because they always sounded blocked and bad, and they felt embarrassed to their family because they're always so tired and so in a bad mood. And they had very trouble finding their way through our healthcare systems. They didn't know how to do that. Sometimes they couldn't find the right treatment. And then there were the unmet needs for the medical community. So they said, we don't have the right treatment, or I always have to use systemic steroids. And I know it's so bad for me, but otherwise I can't function. So this was a really emotional aspect of the whole thing, to hear patient testimonials and how much it involved their daily life. Just some data about the web-based survey that we had. Here you see the numbers of patients that filled in this survey. You see their onset of symptoms, considerably a large prevalence of patients with chronic rhinosinusitis with nasal polyps. Most patients had surgery and medication, of course. So we asked them, for example, who was your first contact? And you can see here the different colors are the different countries, and you see the differences between those countries. For example, in the Netherlands, you cannot bypass a GP. If you not go to the GP, it's the same in Sweden. You cannot go to a specialist, but for example, in Austria, most patients, less than half of the patients go to the GP. Most patients are seen by the ENT surgeon right away. And then the time to visit any healthcare professional. Look, most patients take a year before they finally see a doctor with their symptoms. And for some patients, it was more than 5 years before they finally saw a healthcare professional. And if you look at time to see an ENT surgeon, well, it's of course even worse because patients go to a GP first. Then we asked them, where do you try to find information? And I don't know whether you actually Googled information for CRS in your own country, but it's, at least in the Netherlands, it's very worrying. You know, you only find testimonials of patients that you really think, are they totally normal, you know, telling how wonderful the honey is, or the alternative treater, but very, very little normal, good information. So about half the patients tried to find information on their disease, and most patients were not at all happy about the information they could find, or only partly happy. And you can understand that, because if you try to find information, it's really, really bad. Then we asked them, when do you want to receive information? At what part of your patient journey? And it's really interesting to see that that's actually at all moments during the disease, when they have the first symptoms, when they get their first medication, after the visit to the GP, after the visit to the ENT, and when we propose surgery. So in all those periods of the disease, patients need information. And we ask them, how do you want to receive the information? And you can see here that most patients would like to find it on a website or in an app. That's the, we try to, whether they would be interested to have a coach, you know, someone you could call or email, but in general, people felt more comfortable finding it themselves. Then we asked them, what sort of information would you like to know? Well, you can see here the top issues: self-management, treatment options, treatment and disease. That's not very surprising, I think. And here again, the information and treatment options. How would you like it? And again, just like the website, internet is the way they want to receive their information. Very interestingly, I thought, is that patients very seldomly try to find a patient organization. And I don't know whether you have a patient organization in your country. We have in the Netherlands a patient organization for chronic rhinosinusitis and nasal polyps. But they actually say it's quite difficult to engage patients to be more active, to help to treat their own disease. So to summarize, we need patients' advocacy. We, as Peter said already, we have to influence governments and payers to help our patients. We need, there's need for timely access to treatment, and very much a need for unbiased and effective information. And we started that with Aphoria. We started that with the sinus coach. We showed this already. So this is the app. This is the way patients can fill in their daily symptoms and use that to inform their doctors how they're doing. And we, as a doctor, you can read the QR code from the patient and see the symptoms on your own computer, and in that way help the patient to improve the situation of the patient. So for the moment we have flyers, there's YouTube, and in all sorts of ways we try to help patients to further improve their need for better information about the disease. Thank you very much. And I'm very, very happy to answer questions.